This session presentation is being recorded for assessment purposes for my course with Swinburne Open Education. This session will be recorded and submitted through my course online learning platform to my assessor for grading. All participants in this session indicate their consent to be included in this recording by stating their name and job title. My name is Lisa Dickens and I'm participating as the personal care worker and I consent to this recording.
And my name is Andrea Baker and I consent to this recording for assessment purposes for my course with Swinburne Open Education.
And we will begin. Hi Andrea, thank you for meeting with me today. I wanted to let you know about an incident that happened during my shift yesterday and discuss the safety concerns.
Hi, of course, I'm happy to help. Please tell me what happened.
I was covering a shift for Richard's usual carer as they are away on leave. Richard is 82 years old and has early dementia. During my shift, I noticed he'd accidentally cut himself with a sharp object. The wound was open, so I got the first aid kit and went to his room to clean it and put on a dressing. When I went in, I introduced myself and explained who I was, why I was there. Richard seemed confused and told me to go away because he didn't want any milk. I calmly explained again that I was there to help with his wound, but he became really upset.
Okay, that must have been really difficult. What did you do?
As I was getting the dressing ready, Richard became angry. He threw everything out of his first aid kit onto the floor and yelled at me not to touch him. One of the trays hit my foot. It was a serious injury, but it did give me a fright. I knew it wasn't safe to continue, so I stopped what I was doing and stepped back to give Richard some space.
Yeah, no, you handled that really well. What happened after that?
Once I knew everyone was safe, I reported the incident to my supervisor and the registered nurse. I also completed an incident report and documented what that Richard had refused treatment.
Yeah, you've done the right thing. That's exactly what our workplace procedures require. What safety hazards did you identify?
The biggest hazard was Richard becoming aggressive because of his dementia and confusion. That created a risk of injury for both of us. The other hazard was all the equipment and the sharp objects ending up on the floor. Someone could easily have tripped over it or been cut.
Yeah, and how would you rate those risks?
I would rate Richard's aggressive behaviour as a high risk because it's likely someone could get hurt if the situation isn't managed properly. The equipment on the floor would be a medium risk because it could cause trips or cuts if it wasn't cleaned up straight away. Andrea, do you think there are other control measures we could put in place to reduce the risk for both staff and residents?
Yes, I do. I think we should review Richard's behaviour support plan and make sure all staff know the best way to approach him. And if he needs wound care again, it may also be safer to have 2 staff members present so one person can provide reassurance while the other performs the treatment.
Yeah, I think that's a really good idea. Having another staff member there could help keep everyone safe, and reviewing his care plan would make sure we are using the best approach for Richard's individual needs.
Yeah, and then what control measures would you then recommend?
First, I'd stop the treatment if Richard became upset and keep a safe distance until he was calm again. And secondly, I'd ask another staff member or the registered nurse to help before trying again. I'd also make sure the sharp object and anything on the floor was cleaned up safely, and that I followed infection control procedures by wearing gloves and using PPE.
Yeah, that's really good strategies. Is there anything else you think could help?
Yes, since the behaviour was unusual for Richard, I'd suggest reviewing his care plan. There might be something that's changed, or there may be new ways we can communicate with him that may help him feel a bit
Yeah,
calmer.
yeah, that's a great suggestion. We can definitely look at that. Now, talking about workplace policies, do you have any ideas about how we could improve them?
I do. One thing I would help is reviewing incident reports regularly so we can look for patterns and learn from them. Another idea is having more refresher training for staff on dementia care and de-escalation techniques, because every resident responds differently.
And they're both excellent ideas. How would you help put those into practice?
I'd make sure I followed the updated procedures myself and encourage my co-workers to do the same. I'd also attend training sessions and team meetings, share any safety concerns I notice, and speak up if I think something could be improved.
Yeah, that's exactly the sort of teamwork we want. How do you keep your own safe work practices up to date?
I always attend the mandatory training that the workplace provides, like manual handling, infection control, and work health safety training. I also read any updates to workplace policies and procedures. Another thing I do is take part in team meetings, because we often talk about incidents, hazards, and safer ways of working. If I'm unsure about something, I'll ask questions rather than guessing.
Yeah, that's a really good approach. Working in aged care can sometimes be stressful. What do you think are some common causes of stress or fatigue?
One cause is dealing with challenging behaviours from residents, especially when they're confused or distressed. Another is when we are short-staffed because everyone has a heavier workload. The third is working long shifts without enough breaks, which can make you tired and affect concentration.
Yeah. If those things started affecting you, who would you report them to?
I'd speak with my supervisor first. If I needed more support, I'd also talk to you as the work health safety representative or the manager. If stress was becoming ongoing, I'd also use an employee assistant program if one was available.
That's exactly the right thing to do. But before we finish, let's debrief about Richard. What would you do if something like this were to happen again?
I'd stay calm and speak to him in a gentle voice. I'd give him time to process what I was saying instead of rushing him. If he still refused treatment or became aggressive, I'd stop immediately and ask another staff member or nurse to help. I'd also make sure everything was documented properly and report any concerns straight away. Andrea, is there anything else you think our team could do better to support Richard?
Yes, I think we should make sure all staff caring for Richard are aware of any changes to his behaviour. We could discuss his needs during handover and make sure everyone understands the strategies in his care plan. At least that way we're providing consistent care and reducing the risk of future incidents.
Yeah, I agree. Sharing the information during handover would really help everyone respond in the same way. It would also make Richard feel more comfortable because staff would know the best way to communicate with him. I think regular dementia communication training would also help staff feel more confident. I'd also like to see care plans reviewed whenever a resident's behaviour changes, so everyone knows the best way to support them.
Yeah, those are really valuable suggestions. I'll bring them up at our next WHS meeting and make sure your recommendations are considered.
Thanks, Andrea. I appreciate having the chance to talk it through. It reminded me how important it is to report hazards, follow workplace procedures, and work together as a team to keep everyone safe.
Yeah, absolutely. You handled this situation professionally, and your reporting will help us improve safety for both staff and residents.
Thank you. I'll keep following our work health safety procedures, attend training, and report any hazards or incidents if they happen again.
That's great, Lisa. Thank you for taking the time to speak with me today.
Thank you. Take care.
Thank you.